Thanks for the opportunity to share some of our research in Ateneo Policy Center. This briefing will be composed of two parts. The first part will focus on our effort to manage the pandemic and to move from pandemic to endemic, essentially to live with COVID-19, as well as the governance of the pandemic handling. And the second part will focus on the elections and the leadership landscape, as well as the prospects for reform moving into the next administration. Let me begin by first describing the situation in terms of flattening the curve or handling COVID-19 in the Philippines. I will focus first on Metro Manila with the intention of showing at least the links between the mobility restrictions here reflected by the different categories created by the IATF and the surge in cases over time since the pandemic essentially started in early 2020. And if you look at this figure, which focuses again on Metro Manila, it's very difficult to juxtapose the mobility restrictions when you look at the entire country, because there were different mobility restriction categories applied across the Philippines. But if you look at this, we have essentially faced at least five surges in the number of cases and threats of surges. And each time we have been forced into severe mobility restrictions and tighter mobility restrictions. Essentially, we have been pushed back to lockdown every time we faced the threat of a surge or an actual surge. It was starting out in March of 2020. There was another surge in August of 2020, and again in April of 2021, and then again in August, September of 2021. And once again, the most recent surge of Omicron cases or driven by Omicron variant in early 2022. In all cases, the government has had to apply tighter mobility restrictions. And this is, in a nutshell, the unfortunate situation of the Philippines, because those mobility restrictions, the lockdowns, have a severe negative effect on the Philippine economy, considering that it has two main effects. One is that the Philippine economy is essentially driven, at least a big chunk of it, by services sector. And that services sector is very, very sensitive to lockdown. And so if you apply a lockdown, that entire sector suffers a lot. And obviously there will be high economic costs. The second part is that if you are unable to flatten the curve and show that your containment strategy can prevent COVID-19 from overwhelming your health system without having to turn to a lockdown, then you essentially potentially develop expectations that you will need a lockdown every time there is the threat of a surge or the threat of a new variant. And this seems to be the situation right now for the Philippines, and it's unfortunate because you can think of the threat of surges as tests of our containment system, tests of our health system, social protection systems. And each time it seems we have failed that test and we have had to apply the strictest of responses, which is the lockdown. So what has been the economic impact? If you look at the growth rates across at least the period between 2020 and 2021, which covers at least about, I suppose, three at least of the surges, you will see that the Philippine economy is among the worst hit, if not the worst hit in our part of the world, and certainly in the ASEAN region. And in terms of the impact of the COVID-19 outbreak itself in early 2020, and the impact of the Delta variant in Q3 of 2021, the Philippines actually in this entire period was the laggard of the region and the most negatively impacted, as you can see from this figure. So going into the fourth quarter of 2021, there was growing concern over Omicron variant, which was already being observed in different regions in the world. And this was the period, if you recall, when the Philippine cases was actually declining. And our government was sort of in a rush to begin to open up the country, largely because we needed to recover some of the economic losses, or recover from some of the economic losses of the previous almost 2 years. But if you look at our preparedness for this opening up and taking advantage of that lull in COVID cases, there were many assessments by different international think tanks and business groups that gave the Philippines among the lowest scores in terms of preparedness for future surges, and certainly for the emerging risk of Omicron, which we knew about as early as early fourth quarter of 2021. So the Philippines was in late 2021 in the bottom of Bloomberg, Nikkei, and Oxford economics resilience measures, which were all reported around that time, except for our apparent progress in vaccination, particularly in NCR, the National Capital Region. The Philippines did not seem to exhibit the strengthening of the health system, the strengthening of the social protection system, nor the strengthening of our test, trace, and treat strategies. And even if you consider the vaccinations a victory, which to some extent it is, there are still concerns about the vaccination inequality that appears to be the pattern in terms of overall vaccination across the country, which I will show you next. If you look at the assessments of World Bank and Goldman Sachs when Omicron eventually hit Philippine shores in early 2021, World Bank noted that the slower vaccination and higher mobility during the holiday season were the likely causes for the Philippines being among those most affected by surge in the region. And then there was also the assessment by Goldman Sachs, which noted that the Philippines was among the Asia Pacific's laggards in mass vaccination, and therefore was in a catch-up mode. So even if there was a positive development from catch-up, the Philippines only had about 54% of its population fully vaccinated by early January, as compared to very high vaccination accomplishments for countries like China, 90%, Singapore, 89%, South Korea, 87%, and of course, Australia, Japan, and Vietnam, 80%. Malaysia and Taiwan, 79%, and New Zealand, 78%, and so on and so forth. So the story for the Philippines has been that because of our weaknesses in systems and our late catch-up in terms of vaccination, we have been forced back to lockdown and deeper mobility restrictions. And when you compare mobility across the different countries, at least in our part of the world, the Philippines has the worst mobility indicators, meaning that our people are not able to engage the economy and sort of sustain it in a robust way. So these are Google mobility indicators, which has been one of the indicators that we can track, thanks also to the intensified use of online apps and tracking apps, which flourished during the pandemic period. You can see that the Philippines here is among the least mobile, and given our, as I mentioned, our services sector being highly dependent on mobility, therefore you can predict that the Philippines is, because of the structure of our economy, one of the countries that will be expected to be most hit. So here, in terms of recreation and in terms of workplaces, the Philippines is sort of lagging in terms of mobility. I believe the message, the emerging message from pandemic handling and best practice coming across the world is that the extent to which you can balance controlling the disease, minimizing its health impact on your population, while keeping your economy running and keeping as much of your mobility preserved, is really the balancing act that the most successful countries have been able to achieve. And if you just focus on the economy or just focus on health, on either of these sides, then you are unlikely to actually come up with good results for your country, because you will then end up sacrificing the other side and producing heavy costs, either on the health side or on the economic side. I just want to show here before I end this part of the presentation that, as I mentioned, there is a catch-up period in terms of vaccination, primarily in 2021 in the Philippines. We are a laggard as far as the Asian region is concerned, but there was an impressive catch-up, to be fair, that was implemented in 2021. The challenge now, of course, that's a good development, but the challenge now is the imbalanced vaccination pattern across the country, which, if you look at these figures, first, the imbalance favors the richer parts of the country, which could make sense as a priority of the government to preserve our economic engines. But it can also be observed that this kind of a pattern is much more unequalizing, because we tend to be protecting less those parts of the country that are actually already, much less protected from stronger health systems, by poverty reduction, and so on and so forth. They are actually less developed areas. The other part of it, of course, is that the booster patterns are still favoring the richer parts of the country. And as we know, because of the early application of some of the vaccines, which have, according to the science, sort of a faster half-life, there needs to be boosters applied to that part of the population. And once again, the advantage seems to be to those richer parts of the country, where the boosters are now, exhibiting at least fast application to the population. So this is just another way of looking at that previous figure. And just to drive home the point, I draw this line, as well as the laggard, which is BARM. If you can basically cross-plot across the poverty incidence and the vaccination track record across the different Philippine regions, you will see here that it's almost as if we concentrated our vaccination drive in the richest parts of the country and forgot about the poorest parts of the country, with the exception of a few outliers, such as Western Visayas, and of course, Davao region, which seems to perform much better than what its income level suggests. So there is also the question of whether some regions are prioritized because of motivations other than scientific and motivations other than supply driven. And it is going to be a lingering question to the extent that there appears to be an inequality in the vaccination patterns in the country. So hopefully this is part of the catch-up as well, for the poorest parts of the country to catch up in terms of its capability to get vaccines in arms, get those jabs in the arms. The challenge, as we see it moving forward into the May 2022 elections, is that if these parts of the country are less vaccinated, there could be a chilling effect also on the population. And should there be a threat of a new surge, of a new variant, emerging in the Philippines, then those parts of the country will still be quite vulnerable, and they are typically the poorest parts of the country as well. So now at this point, when I'm presenting this in early to mid-February of 2022, there appears to be some thinking to move continuously from alert level 4, which was the peak in the Omicron surge, all the way to alert level 1 as cases are continuing to decline. And as it seems, there appears to be at least some decline in the number of hospitalizations and mortality. This gives us a little bit of confidence that the vaccination is working, and much of the population is protected, at least from hospitalizations and mortality, but not necessarily from sickness, and not necessarily from the economic costs that sickness actually implies. The movement to alert level 1, which seems to be considered, we could actually see it within the next few days, if the government decides to move ahead, sees a continued loosening up of restrictions to only very specific areas with high risk of infection. Of course, there will still be capacity limits in business establishments, whether indoor or outdoor, in public transport, which was in previous alert levels, which will be reduced to almost nothing in alert level 1. And then there will be a higher emphasis on self-regulation following the minimum public health standards, masking, hand washing, avoided crowded areas, and observing physical distancing. And then, of course, the physical infrastructure adjustments on greater ventilation and airflow. All of these are part of the emerging good practices in other countries, so they are quite predictable. But what we will cite here, it appears that the social protection system, the health system, the containment system, notably the test, trace, treat, and quarantine systems, it is less clear to what extent these have all been strengthened in the meantime. And it is less clear to what extent the country is going to be protected from the risk of a new variant and the risk of a new surge. And once again, even as the evidence seems to suggest a lowering of hospitalizations and mortality, at least from the Omicron experience, the emerging science worldwide appears to acknowledge that there could still be variants that are much, much more severe than Omicron. And there is really no, or there is little capability to predict whether future variants will no longer be a risk or future variants will no longer be as severe as the earlier variants. So this appears to be the emerging observation of some epidemiologists, top epidemiologists, who are trying to get a sense of whether the COVID-19 pandemic is now behind us or behind the world. It is not yet, according to this emerging science. So to end, there appears to be some systems weaknesses that are still lingering in the Philippines, and the general assessment is that the Philippines has been less successful in the Asian region to contain and to flatten the COVID-19 curve. And the tough response, the lockdowns, the severe mobility restrictions have imposed a big economic and social cost on the Philippines without delivering a commensurate benefit in terms of containing the disease, to the extent that we still saw those large numbers of infections, as well as early on large numbers of hospitalizations and mortality. This all only eased a bit when the vaccination was already catching up. But that, again, that doesn't mean that there are no social and economic costs from high numbers of Filipinos workers actually falling ill while not being hospitalized or not suffering from mortality. That still imposes high social and economic costs and could even produce a chilling effect, once again, a continued lingering chilling effect on the economy and delay the economic recovery in an economy that is highly dependent on the services sector. To close, I just wanted to emphasize a few points as far as what are the emerging good practices in terms of moving from pandemic to endemic and living with COVID-19. It's not rocket science. This is actually drawn from a broad review of literature from the emerging science and the emerging public policy and pandemic management practice. First is containment, very strong test, trace, and treat and quarantine capabilities, which could be rapidly aligned to face the risk of a new surge. Strong and inclusive social protection. Obviously, these are the safety nets that a country can put in place in order to reinforce the behaviors and the micro-level adjustments in households and in firms that would be necessary to prevent the spread of the disease. So think of asking a worker, a low-income worker, to actually stay home when they are infected, when they might not even have unemployment insurance. And so that worker may not necessarily follow the restrictions and may even end up infecting more people. So these are some of the systems that need to be in place: the social protection system, certainly the health system, universal healthcare. Countries with this may be expected to weather this storm much better, with less hospitalization, with less social costs, and certainly minimizing the impact on human capital. Robust and inclusive health insurance, and I've been in enough webinars in the region to observe that many policymakers are thinking of both formal and informal health insurance, to the extent that the informal economic sector is pretty large in many parts of the Asian region. So that informal economy, without the formal insurance, without the formal work arrangements, they will still need to be protected. They will still need to be part of the government response. And so one must start to think about how they can access healthcare, access social safety nets in order to be part of that response. And finally, there is the element of social cohesion, which is extremely important. And I just want to emphasize the lingering challenges of mis, dis, and malinformation, which then has an impact on vaccine hesitancy. Fortunately, in the case of the Philippines, that has been declining over time, but it is still a challenge, particularly something that we are concerned about as we roll out vaccination for younger children ages 5 to 12. And so I just want to emphasize that the emerging basically lesson from over 2 years of pandemic management, looking at all the variables, and this is a very exhaustive study published in the Lancet recently. It finds across a data set of over 177 countries, looking at performance indicators such as hospitalizations, infections, and mortality, fatality rates. And it shows that one of the bigger factors that affects a country's capability to contain COVID-19 is essentially the high levels of government and interpersonal trust, as well as less government corruption, which are all associated with higher COVID-19 vaccine coverage among middle and high-income countries where vaccine availability was much more widespread, and lower corruption was associated with greater reductions in mobility. If these modeled associations were to be causal, an increase in the trust of governments such that all countries had societies that attained at least the amount of trust in government or interpersonal trust measured in Denmark. Denmark appears to be one of those countries that are now lifting these many of these restrictions and trying to move to endemic. Then if we are all at the trust level of Denmark, according to this study as modeled, which is at the 75 percentile across the trust spectrum, then you could have reduced global infections of COVID-19 by 12.9% in terms of government trust, and 40.3% for interpersonal trust. Now, just to emphasize what that means, if you actually had a 40.3% reduction because of strong interpersonal trust, Denmark level interpersonal trust, we are talking about 160 million cases worldwide reduction if that kind of trust were present in different countries. And we are talking about almost 3 million citizens saved, almost 3 million reduction in fatality if we had that interpersonal and government trust built into many government responses on the pandemic. So this is, of course, one of the areas where, admittedly, in the Philippines, this is an area we need to improve on. I'll just give you a few examples. If you look at the public debt to GDP ratio for the country, which is part of the concern now of deep economic scarring moving forward, there is an increase in the public debt and a compacting of the total GDP of the country, which produces a more adverse debt to GDP ratio, which is what you see here projected for 2021, 63.1%. And yet, this was occurring during the time when you had deep governance issues, such as what we're seeing in PhilHealth. PhilHealth was actually predicted to collapse by 2022. This is this year. If we were not able to actually plug the holes in this particular health insurance system. Of course, the allegations of massive corruption in the social protection safety net measures in terms of resources being provided to the people during the pandemic itself, during the lockdowns. And then finally, the continued procurement challenges for the Department of Health, which is seen to face enormous trust issues right now during the time when we cannot afford to distrust those who are leading our effort against the pandemic. So let me just end it there and conclude this first section in my presentation, which is focused on the pandemic response and the lingering challenges of pandemic management in the Philippines, as well as the prospects for moving forward from pandemic to endemic, part of the success in terms of vaccination catch-up, but also the lingering challenge of vaccine inequality, which may actually have an effect on uh, a more delayed economic recovery, as well as have implications for the May 2022 elections in terms of the continued chilling effect it may have on the less vaccinated regions.